Health and Hygiene for Servsafe 2024 exam question. Personal Hygiene Program. Ensuring personal hygiene is being followed to reduce the spread of foodborne illnesses. Reportable symptoms. Vomiting, diarrhea, jaundice, sore throat, fever, strep, nausea, lesion-containing pus. Actions taken for sore throat and fever. Restricted to non-food tasks unless the establishment works with highly susceptible population. How to remove restrictions or exclusions for Shigella. Be asymptomatic for 7 days. Restriction. When an employee is restricted to working with non-food contact tasks at an establishment. Asymptomatic carriers. Carriers that do not have visible signs of a pathogen but carry it nonetheless. Norovirus is often an asymptomatic virus. What ready-to-eat food is allowed to be touched with bare hands? When washing fruit or vegetables. How to remove restrictions or exclusions for non-typhodial salmonella. Be asymptomatic for 30 days. Highly susceptible population. HSB, groups that include young children, elderly, pregnant women, and immune-compromised, that are highly susceptible to illnesses. Actions taken for jaundice. Excluded from work and reported to the regulatory authorities. Actions to take for vomiting or diarrhea. Exclude employee from establishment until symptom-free for 24 hours. Typhoid Mary. Mary Mallon, an early 1900s cook who was the source of a typhoid outbreak, Salmonella typhi, caused by the fecal-oral route. Exclusion. When an employee is excluded from working at any part of a food establishment. What causes 35% of foodborne illness outbreaks? Bare hand contact causes 35% of outbreaks in restaurants. Following health and hygiene practices reduces these numbers. Removal actions required. Regulatory approval, doctor's note, or situational depending on the foodborne illness was. What is the best way to prevent foodborne illnesses from employees? Ensure proper hand washing is being completed, ing heathens. What causes 65% of foodborne illness outbreaks? Sick food service workers cause 65% of outbreaks in the restaurant industry, and 20% of all foodborne illness outbreaks. How to remove restrictions or exclusions for E. coli. 7 days without symptoms. 5 steps for hand washing. Wet hands with warm running water. Apply soap, generously scrub for 20 to 30 seconds, including between fingers, up the wrist, and under the nails. Rinse under the warm running water. Dry hands on a paper towel, then turn off water with said towel. Bare hand contact with food. When food workers do not use gloves when handling ready-to-eat foods, using their bare hands. This is not allowed under most circumstances. Normal duties. When an employee is allowed to perform all normal duties after being exposed to a foodborne illness, depending on the customer base. Reportable illnesses. Norovirus, hepatitis A, Shigella, E. coli, Salmonella typhi, no typical salmonella. How to remove restrictions or exclusions for Salmonella typhi. Must have a doctor's note. Symptomatic carriers. Visibly sick carriers of a pathogen. How to remove restrictions or exclusions for norovirus. Remain asymptomatic for 48 hours. Lifespan of single-use gloves. For hours, as that is the amount of time it takes for bacteria to grow to dangerous levels. How to remove restrictions or exclusions for hepatitis A. Have jaundice for 7 days or other symptoms without jaundice for 14 days. FDA guidelines for foodborne illness in employees. Guidelines implemented by the FDA to reduce food contact of symptomatic foodborne illness carriers. Other circumstances allowing bare hand contact with food. 1. The establishment does not serve HSB. 2. Local regulatory authority provides approval. 3. Proper procedures and policies are in place for bare hand good contact. 4. Documentation of bare hand food contact training is maintained. 5. Precautionary steps are taken before bare hand food contact happens. 6. Documentation and correction of violations that occur. L. Actions taken for lesions with pus. Restrict from food tasks until a double barrier has been applied to lesion. Double barrier. When a wound or lesion is covered by a bandage or similar object as well as a finger cot or glove above it to prevent the bandage from falling into food. Exclusions and restrictions. Guidelines used on when an employee should be excluded or restricted from working with food when exposed to foodborne illnesses.